My name is Prof Etter. I'm a professor of public health here at the University of Geneva. For the past almost 20 years I've been working in the field of smoking prevention, smoking cessation, and in recent years I've conducted a couple of studies on e-cigarettes, in particular surveys of vapers, of users of e-cigarettes. In the United States, where we have figures for the past years, the e-cigarette sales tripled every year since 2007, when they were first introduced there. In the UK, they also more or less double every year. It tells a lot about how people appreciate and like these products. We have one study that will be published very soon on e-liquids. We analyzed the content of the liquid and the impurities related to nicotine. We conducted this analysis together with the lab in Sweden, where nicotine gums and patches are manufactured, and they did this analysis for us for 20 different bottles of e-liquids that we purchased on the internet, and results showed that the quality was surprisingly good, in fact. The liquids deliver much fewer chemical compounds than smoke. In smoke there are several thousand chemical compounds that were identified, and hundreds of them are recognized as toxic. You don't have many reasons why e-liquids should be toxic. Of course there's a need for studies, but it's probably much less toxic than tobacco, of course. On the 7th of May in Brussels, the Environment and Public Health Committee of the European Parliament convened a workshop. Mr. Roberto Bertolini made a presentation at the EU workshop that was appalling.
Nicotine you can have overdose of nicotine, which can create major problems, both to the gastrointestinal, respiratory, cardiovascular, neurological system.
His presentation consisted in cherry-picking negative studies that show that e-cigarettes are bad, and deliberately omitting studies that suggest that e-cigarettes could be useful in helping people quit smoking. So I confronted him on that, and he didn't like it.
And also cases of malfunctioning that were mentioned before might produce a high level of nicotine, which might, particularly if used by children, adolescents, determine some cases of acute intoxication, which has to be taken into account.
If a student had presented such a work to me, I would have given him a very bad grade. WHO, after all, is here to protect the health of the public, and by taking such an approach, they are not doing their job. It would be a mistake, I think, to regulate these products as medications. And if they were regulated as medications, this would limit access to the product too much and cause many deaths, actually. There's a debate between policymakers who are very conservative and very risk-averse and are ready to regulate this as medications, and the public who appreciates the product, uses it. Astonishingly, the most vocal opponents to e-cigarettes are people from the public health community who perhaps don't understand what is at stake and just don't like the product because it looks too much like a cigarette. If regulators let the market evolve without regulating it too much and without regulating it unjustly, because currently people who are addicted to cigarettes are condemned to use tobacco by the current legislation. These laws arguably kill millions of people. They are absurd because they block every competitor to cigarette makers. So there's a need to let competitors enter the nicotine market, so more people will switch from smoking to e-cigarettes, and this will save many lives.